So good afternoon everyone. I am Jaira May and Agwarin, your nurse for today. Today I'm going to perform or assess about postural drainage. So the first one you need to do, of course, the chest physiotherapy. It is consists of physical maneuvers such as cup, chest wall percussion, vibration and shaking, and postural drainage. And the second one is, of course, postural drainage is achieved by positioning the client so that the position of the lungs segment to be drained allow gravity to have its greatest effect. And then for the third one, it is achieved by the gravitational clearance of airways secretion from specific bronchial segments by using several different positions. Okay, and then the fourth one is each position drains specific corresponding section of trachea bronchial tree and with whether from upper, middle, or lower lung fields into trachea. And then after that, the areas are selected for drainage based on, of course, a knowledge of client's condition and diseases process, and then physical assessment of the client, and then chest x-ray examination result. And then the last one is extent or pathologic condition and lobe involvement based on a physical exam and chest x-ray findings. So for the assessment, of course, determine the presence of indication for postural drainage. And the first one that I need to assess is ineffective coughing. And then the second one is thick or sticky secretion that are difficult in cough up. And then the third one, I need to assess abnormal breath sounds, increases vocal fremitus, or complete loss or decrease of breath sounds. So for the next procedure, I need to determine the presence of contraindications procedure, and then I'm going to position Ma'am Jamie the Chandelenberg position, and also I need to check if she has a head injuries. And then the next one, if it is increase the intracranial pressure, of course, and her recent MI, plus the lung hemorrhage, and then the certain surgical procedure, and also, of course, the pain, and also the traction. Next, let's proceed to the nursing diagnosis. So for the nursing diagnosis, of course, I need to see ineffective airways clearance, ineffective breathing pattern, and also the last one, the impaired gas exchange. So what are the planning for this assessment? Of course, I need to prepare all the materials and the supplies needed for the procedure. So the number one is Chandelenberg hospital bed or table is used for client's positioning. Since I am here in our house, I don't have any hospital bed. So I just have here a bed, the normal bed, and also the table. And then the number two, water pitcher and glass for fluid intake. So I have here a water pitcher and a glass for the fluid intake. And then after that, the chair for the draining upper lobes for positioning, which is I have here. And then 1 to 4 pillows for support and comfort, which is I already have here. And then, of course, tissue and paper bag for secretions, which is I already have here. So for the next step for the assessment, of course, the implementation. So for the implementation, I need to identify the client, and also I need to explain the procedure to her. So, ma'am, yung pong gagawin ko, tutulungan niya po kayong makahinga ng maluwag. So, the next one, I need to exchange the high fluid intake program if not contraindicated by the other disease. So, ma'am, kailangan nyo po laging uminom ng tubig. Nakakabuti po ito or nakaka-help po ito para po lumabas po ang yung plema or ang yung mucus. And then, of course, third one, I need to plan the treatment so they do not overlap with the meals or the feeding. Of course, the number 4, put tissue and paper bag for section within reach of the client. So, kailangan nating maglagay ng tissue or paper bag sa side table para agad maabot or kapag gusto ng pasyente ng kailangan. Number 5, you need to schedule the treatment of appropriate times of the day. So, of course, dapat every now and then, kailangan mong tinitignan yung mga kailangan niyang inumin na gamot or kung ano ang kailangan gawin sa patient. And then, of course, I need to perform hand washing, which is I have here an alcohol. So for the procedure, of course, I need to place the client in a position to drain the congested areas. First areas selected vary from client to client. Help client assume position as needed. And also, I need to teach the client in a correct posture and arm or leg positioning. And plus, I need to place the pillow for support and comfort. And also, drape clients appropriately positioned for postural drainage. So, left and right upper lobe anterior apical bronchi. So, for the A, left and right upper lobe anterior apical bronchi. So, for the first one, have the client sit on a chair, which is she already seated. And then I'm going to tell her to leaning back, which is, ma'am, pwede po ba kayong sumandal? And then, pwede po bang paki-relax and i-flex niyo po ng kaonte ang yung kamay at paa? Thank you. And then, I need also to percuss and vibrate with the heel of the hands at shoulders and also fingers over the collarbones or clavicle in front. So, ma'am, iper-percuss ko lang po kayo. And then, after that, I need to vibrate with the heel of my hands at shoulders, which is this one. And then, after that, of course, the nurse back is kept straight, or elbows and knees are slightly flexed, which is I already told her a while ago. And then, for the B, left and right upper lobe posterior apical bronchi, which is have the client sit on the chair leaning forward on a pillow or table. So for the B, left and right upper lobe posterior apical bronchi. So have the client sit on a chair, which is she already seated, leaning forward on a pillow or a table. So I'm going to give her a pillow. So, ma'am, can you lean forward po? Yan. So, nakalean na po si ma'am. And then, after that, I need to percuss and vibrate with the hands on either side of the upper spine. So, I need to percuss her again. Or dito ba?
Ano wala ka lang?
Sabi, percuss.
Side lang naman eh, upper, either side of the upper spine.
Yun, ginawa ko na, no? Ulit.
Vibrate mo.
And then after that, I need to vibrate with the hands. So for the next one is, of course, the right and left anterior upper low bronchi, which is have the client lie flat on her back with a small pillow under the knee. So she already lying flat, and I'm going to put this pillow under the knee. Ma'am, pwede kong pakitaas ang yung paa? That. So the next one, I need to percuss and vibrate just below the clavicle on either side of the sternum, which is this one, the other, or just below the clavicle. I need just to percuss it. And then D is left upper load ligular bronchi. So have the client lie on the right side with the arm over the head, which is Trendelenburg position, with the foot of the bed raised 30 cm. So left and upper lobe lingular bronchus, of course, have the client lie on the right side with the arm over the head in Trendelenburg position, with the foot of the bed raised 30 cm to 12 inches, which is, I already tell her to do it. And then you need to put her arms here and this one. Yeah. So here's the first one. And then percuss and vibrate the lateral left nipple below the axilla. So and then percuss and vibrate the lateral to left nipple below the axilla, which is, you need to percuss and vibrate here. The right middle low bronchus, of course, have the client to lie on her left side with the foot of the bed raised 30 cm to 12 inches.
Pero hindi natataas.
Which is that. And then place a pillow behind the back and roll the client's 1/4 turn on into the pillow, which is I already did. And then I need also to percuss and vibrate the right nipple below the axilla, which is here. I need to percuss it and also vibrate. So for the F is left and the right anterior lower low bronchi. So have the client lie on her back within the Trendelenburg position with the foot of the elevated 45 to 50 centimeters and 18 to 20 inches, and have knees bent on a pillow. So, ma'am, pwede pong pataasan yung paa. Thank you. And then, percuss and vibrate over the lower anterior ribs on the both sides, which is I'm going to percuss. So, and also I need to vibrate it by using heel. So So for the G, right lower lobe, lateral bronchi. So have the client lie on her left side in Tendylan Burge position with the foot bed elevated with the 45 to 50 centimeters, 18 to 20 inches, which is I already asked my patient to do so. And then I need to percuss and vibrate on the right side of the client below the scapula posterior to maxillary line. And then the left lower lobe, lateral bronchi. So have the client lie on her right side in Trendelenburg Burge position with the foot bed elevated to 45 to 50 centimeters and 18 to 20 inches, which is I already asked her to do so. And then I need to percuss and vibrate over the lower anterior ribs on the both sides. So here I need to percuss her and vibrate for the both sides. So for the eye, right and left lower lobe, superior bronchi. So have the client lie on her stomach with a pillow under the abdomen, and also percuss and vibrate below the scapula or either side of spine. So, I'm going to percuss and vibrate below the scapula on either side of the spine, which is here and here. You need to percuss this one and that one, and also vibrate for the both sides. So for the J, or for the last one, left and right posterior basal bronchi, have the client lie on his or her stomach in Trendelenburg position with the foot of the bed elevated still 45 to 50 centimeters and also 80 to 20 inches. And then I need to percuss and vibrate over the lower posterior ribs on or the other side of the spine, which is here and here. So have the client maintain posture for 10 to 15 minutes in adult. Draining each areas takes time, of course. And then during the 10 to 15 minutes of drainage, in each posture, perform client's percussion, vibration, and shaking over the area being drained. And then the maneuvers provide mechanical force and the mobilization of airways secretion. And then have the client rest briefly, if necessary, between posture. Short rest period between postures can be prevented fatigue and help the client to have a better tolerate therapy. And then after that, have the client to take a sip of the water, so keeping mouth moist aids in all expectations of secretion. So I have here a water. Ma'am, uminom po kayo ng tubig. Thank you. And then after that, I need to repeat the steps 12 to 17 until it's all congested areas selected. Hand hygiene. So the infection control technique that minimize the cross contamination. Minimize. And then for the last one, of course, monitor the client response to therapy. auscultate patients' lungs to evaluate the effectiveness of therapy, plus also inspect the character and amount of the sputum, obtain the vital signs and the pulse oximeter, which is I don't have. I just need to para matignan kung merong pagbabago after the assessment. Inhale, exhale. 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 So after that, after the assessment for the patient, of course, you need to record all the data that you gather, because just in case you are the liable person for that patient. So that's all.